So first things first is I'm washing my hands before I go into my patient's room. Hi there, my name is Julia. I'm going to be your nurse today.
Hi, Julia.
So today we're going to be inserting a nasogastric tube, it's called. It's basically just a tube that runs from the edge of your nose in through your esophagus down to your stomach, and we're going to be taking out some contents of your stomach that shouldn't be there to make you a little bit healthier. Okay? First things first, can I see your ID band? Okay, can you tell me your first and last name?
David Botero.
Awesome, and can you spell your last name for me?
Botero.
Awesome, and your birthday?
1995, 15.
Perfect, so I'm just checking your MRN number to my doctor's orders, and that looks really good. Perfect. Now, do you have a history of a deviated septum, broken nose, or any surgery on your nose?
No.
Okay, perfect. And so now we need to figure out which nair we're going to use to put the tube through. So can you just close one side of your nose and take a deep breath in and out from the outside? Yep. Perfect. And tell me which side is more clear for you.
The right nostril.
The right nostril. Perfect. So that's the one that we're going to use then, the tube through. So I'm just going to put this on here. Keep your clothes all clean. And my patient's in a high Fowler's position. Normally if he was laying in a hospital bed, he might be a little bit more leaned back, but I don't want him to fall off this chair. So this is what we're going to go with for today. So next what I'm going to do is I'm going to measure. So I'm going to start here. I'm going to measure from, and I'll show you on this side even though I'll be inserting on the right nair. I'm measuring from the edge of my patient's nose to the tip of the earlobe. And then down to, sorry, Mia, down to the xiphoid process. Just gonna rip that there, so I know the length of tube that I need. So now I'm going to measure out my tube, and I am using a 10 French, which is good for my adult patient. So I'm going to measure from the tip down here. Okay, and I'm gonna put tape there so I know when to stop inserting. And while I have my tape out here, so that's labeled, while I have my tape out, I'm going to set it up for stabilization once it's in my patient. Whip it down the center here, or to secure it to my patient's nose once it's, there we go. And I'll just keep that aside for later. Okay, so I don't really need that anymore. Next thing we're gonna do is, okay, I'm just about ready to start here. So, David, what I'm gonna tell you about this process is it's not gonna be super comfortable for you. You're gonna feel a bit of like a burning sensation, probably gonna gag. That's okay, that's common in this procedure. So what it's gonna look like is I'm gonna start inserting the tube into your right nostril for you, and I'm gonna have you sitting upright for the first little bit until we get it past your nasopharynx. So I'm gonna have it kind of in the back of your throat there. And then I have some water here for you. What we're gonna do is you're gonna take a sip of water, and while you're swallowing, I'm gonna advance the tube further. And we're just going to kind of keep doing that. So I'm going to get you to swallow a couple big gulps of water, okay? And if you need me to stop at any point, it's too uncomfortable, or you just need a little break, you can give me a hand signal. Maybe you can go like this,
okay,
and I'll know that we need to stop, okay? And yeah, the whole process, it is uncomfortable, but it should only last about 30 seconds, okay? All right, do you have any questions for me before we begin?
Nope.
Okay, perfect. All right, so this I'm pretending is my lubricant. What I'm gonna do is I'm gonna lubricate the end of my tube to help it enter into my patient's nose a little bit more comfortably. All right, now, patient, here is your water. So I'm gonna advance it a little bit, and then I'm gonna get you to tilt your head, your chin towards your chest, and then that's when you're going to be doing your gulping, okay? Are you ready to begin?
Yep.
Okay, perfect. We're going to start now then. Alright, so I'm inserting. Alright, so now we're past your nasopharynx, so can I get you to start doing some big swallowing? Swallow, swallow, swallow. And just keep swallowing for me. And we're in. There we go. That wasn't so bad, was it?
No.
No, how are you doing? Good?
Yeah.
Okay, perfect. So, got it in your nose there. And hopefully we have it in the, where we need it. I'm just going to do some checks to make sure that I have it right exactly where I want it. So this, David, would you mind just holding this here? Because if this was actually in my patient's stomach, it wouldn't be just falling out like that. But I have not put it in my patient's stomach at the moment. So what I'm going to do 2 checks here. Ideally, we would want to do an X-ray, chest X-ray, to make sure that this nasogastric tube is in fact in the stomach. But that's unavailable to us right now. So what I'm going to do is first I'm going to inject just a little bit of air into my patient's stomach. And I'm going to listen for a rush of air to know that I have it in the right place. So, I'll do first. Perfect. So I heard a rush of air there. So I feel fairly confident that I am in the stomach, but just to be sure, what I'm going to do next is I'm going to actually obtain some gastric liquid into my syringe here. Perfect. And just leave that there for just a minute. Alright, so I'm going to inspect the gastric contents, and they look green, which is good. I know that gastric contents are supposed to look green, so I'm feeling pretty good about that. Next, I'm going to put it on my pH strip. So I'm just putting the liquid on the strip, and I'm going to compare it, and I'm hoping that this pH will indicate that it's a pH of 5 or less, because that would tell me I'm in the stomach, and that looks good to me. Perfect. And one last check that I could have done first is get my patient to open his mouth and make sure that the tube is not coiled up inside of the back of his throat, and it looks good. It's all clear to me. Alright, so thank you for holding that. I'm going to just secure it to my patient's nose with this strip that I already prepared. Oh, I actually need to do skin prep first. So I'm going to put that on. Is that actually alcohol? David?
Yeah.
Oh, sorry. So I have my skin prep on. It's going to make this tape stick better. Now I'm going to stick this to the end of my patient's nose.
Oh, it does. I can see that.
Perfect. And I'm just going to wrap these bits around the tube. And this is so that if the tube gets pulled on or anything like that, it's not going to dislodge the tube from my patient's stomach. And hopefully to reduce irritation on my patient's nose too. So that's kind of secured there. And I am going to secure it one other place. I'm just going to secure it to my patient's gown. And I can hook this up to suction now. I've got my suction here to start taking out those gastric contents. Take this off. And I'm going to attach this to my patient's gown. Do you have any questions for me, patients?
Nope.
Perfect. So you just let me know if your nose there is feeling extremely uncomfortable, and we'll see if we can do anything to relieve any uncomfortable feelings you have with that. But yeah, if you have to go to the washroom, just let me know, and we can disconnect you from the suction here, but other than that, we're going to let that go on a low setting for you. All right, you have a good day.
Thank you.